6,146 American veterans died by suicide in 2020. The Department of Veterans Affairs says that is fewer than 2019.
Still, veterans die by suicide at higher rates than people who didn't serve in the military. So to help those who've served our country, the VA is now giving free emergency health care to veterans in crisis.
News Channel 7's Jude Binkley talked to the local VA about this new program that just started today, Jude.
Doug, veterans can go to any VA or non-VA healthcare facility to get care, and vets don't need to be enrolled in the VA system to get help. And because of that, the Department of Veterans Affairs says this program removes a lot of barriers for vets who need help.
I think this is really pretty unique. Honestly, I think it's a really big step the VA is taking to improve access.
Tiffany Foley is the suicide prevention coordinator at the Boise VA Medical Center. She says the program comes from the Veterans Compact Act, which passed in 2020 and is for veterans experiencing suicidal crisis of acute nature.
Meaning happening, right now in the present moment, and needing emergent care to maintain their safety.
The program is effective as of Tuesday. The VA is covering emergency suicidal care for veterans. They can go to the emergency room regardless of if it's a VA facility or not.
Oftentimes we hear from veterans who are in, more rural areas or might have a preference, to seek care at a specific hospital. And so what's really wonderful about this is veterans can access that care wherever, is best for them and most convenient for them.
Veterans don't need to be enrolled in the VA system to get help.
It also includes up to 90 days of follow-up care, including, social work services and counseling and treatment, which is wonderful. And in addition, up to, I believe it's 30 days of residential treatment.
Transportation costs are also covered. If you or a veteran you know needs emergency care, you can call the Veterans Crisis Line by dialing 988 or find immediate care.
Going to the emergency room, they don't have to wait. They don't have to call 988 first. If they're in a suicidal crisis or loved one, realizes that their veteran family member or friend is in a suicidal crisis, they can also help them get to the emergency room, whether that's VA or in the community.
Now, Foley says the VA has done a lot of research on veterans' mental health, and one thing they know is interventions and care does work. Now, as I mentioned, if you or a vet you know is in crisis, you can go straight to an emergency room. It doesn't matter if it's a VA facility or not, or you can call the Veterans Crisis Line by dialing 988.
And such a big deal, too, for the veterans who live in those rural areas.
Oh, yeah. Oh, yeah.
All right, Jude, thanks.